Good morning, everyone. We will be starting shortly. Thank you for joining us for today's call. Good morning, everyone. My name is Reverend Dr. Q English, and I serve as the Director for the Center for Faith-Based and Neighborhood Partnerships at the United States Department of Health and Human Services in DC. So we're excited today to celebrate doulas. For those of you who may not know, doula is a trained non-medical companion who assists a woman before, during, and after childbirth. Doula provides support and advocacy, mediating between the woman and her maternity care providers. They also serve as advocates and a voice for the mother if she feels she needs it. And so on May 12, 2021, the U.S. Senate passed a bipartisan resolution introduced by U.S. Senate Majority Whip Dick Durbin and U.S. Senator Susan Collins, recognizing the work and contributions of doulas toward improving pregnancy, birth, and postpartum outcomes, lowering pregnancy and childbirth-related costs, and reducing the impact of racial bias on pregnant and postpartum women of color. Further, the resolution designates the week of May 9th as National Doula Week in honor of the important work that doulas provide to help pregnant and postpartum women nationwide. The Senate resolution reaffirms the important role of doulas in maternal care and addressing maternal mortality and morbidity in the United States. So today we celebrate the work of all doulas around our nation and those that are represented on this call. To that end, I am happy to introduce to you one of our champions of maternal health here at the United States Department of Health and Human Services, the Administrator for Health Resources and Services Administration, also known as HRSA, Carol Johnson.
Thank you so much, Reverend Dr. English. It is so nice to be here. Thank you for convening us today. I am actually at a White House meeting, which is why that backdrop looks so fancy. But I just wanted to thank you for organizing today's event and recognize all of the work that the doulas on the call today, as well as the advocates and support leaders who have made all of the work that we as a department are doing, who have been champions and voices for the work that we're doing. I just want to recognize everyone and thank you for your incredible work during this National Doula Week. As Dr. English mentioned, I'm Carol Johnson. I'm the Administrator of the Health Resources and Services Administration. We are home to the Title V Block Grant, which means we provide resources and support to every state and territory in the country to support maternal and child health best possible maternal and child health outcomes. We are also home to the 1,400 community health centers across the country that fund and support 15,000 community health center sites that provide healthcare services regardless of people's ability to pay. And many of the individuals that we serve are individuals who would greatly benefit, are benefiting from, or would greatly benefit from doula services. We also are home to the Ryan White HIV program. We are home to the rural health programs across the Department of Health and Human Services. So we have so many vested interests in making sure that community-based doulas are part of the healthcare workforce, are recognized and respected as part of the healthcare workforce, and are able to deliver the kind of critical services we know will improve maternal health outcomes. At a time when we are in such a critical crisis related to the unacceptable disparities in maternal health outcomes, building and supporting, diversifying the doula workforce is a priority for all of us and something that we are committed to doing. That's why we because we are the funders for the Healthy Start program, we've been able to dedicate some of our Healthy Start initiative dollars to building and training programs and other support programs and employment programs to help ensure that the community doula workforce continues to grow. And this is making a huge difference in communities across the country. We're really excited, for example, in Mississippi, that the Delta Doulas Collaborative was formed as part of this alliance, as part of the outgrowth of their Healthy Start program. The Delta Doulas Alliance is doing the Delta Doulas Collaborative, is doing not only the critical work of delivering doula services, but also building the kind of resources and network of community-based organizations that are essential to helping pregnant people be able to get connected to social services, to get connected to the community services and supports that will ensure not only their health and well-being during pregnancy, but post-pregnancy as well. In the DC Department of Health and Nashville Strong Babies and the Foundation for Delaware County, they're using our resources to help hire bilingual doulas to try to address language barriers as one of the critical areas of need here. And in Maricopa County, Arizona, the doula services are being provided to pregnant people who've experienced sex trafficking and to people who are incarcerated. They also have a very nice complement to their program that's focusing on fathers as well. And so we know this funding makes a difference, and we know there's much more work to do. That's why the president's budget for the upcoming fiscal year requests $25 million to grow this work, to grow our investments in the doula workforce. Now, we won't know how that all shakes out until all the various back and forth with our friends in Congress settles when it comes to the budget going forward. But know that we in this administration, in the Biden-Harris administration, are committed to this work. We recognize, support, and respect the work that doulas are doing, the way it's improving health outcomes across the country. And we're going to continue to pull all levers we can to make sure that we are supporting the community-based doula workforce. And so before I wrap up, I just want to highlight two other programs that we funded HRSA that will be beneficial to the community. And also note how nice it is to have this cross-section of leaders on the call here. You know, we work very closely with our colleagues at CMS as they're working to expand Medicaid coverage post-pregnancy in states across the country and have had huge success in doing that. We know that the workforce, we know that the supports that we can get are critical to making sure that there's a real promise. There's real delivery on the promise of health insurance coverage. And so we're really excited to have that partnership with CMS. But just to note, before I wrap, the two HRSA programs I want to make sure everyone is aware of. One, on last Mother's Day, we launched our maternal mental health hotline. And this is our 24/7 confidential expert hotline to provide direct access, a safe space for pregnant people and their families to get access to counselors. We've seen incredible demand for it. And we only had a little bit of resources to launch it. And so we've been testing it out. And we've seen an incredible demand. And so what we're excited to do now going forward is we are simplifying the phone number. So the phone number for the maternal mental health hotline is 833-TLC-MAMA, TLC-MAMA. And we are also making sure that we are expanding in the year ahead. We will be expanding our outreach and awareness about the number and making sure we get the word out. And we welcome your partnership in that effort. And the second thing I'll note is that we will soon put out our funding opportunity to support the maternal depression screening program, where we are working to make sure that everyone in the maternal health workforce gets some training and support related to maternal mental health, and that individual care providers are able to get direct access through teleconsultation to mental health experts. Now, this is a program we've only had in a handful of states because we've only had resources to get it into a handful of states. In the current budget, in last year's budget, the budget the president signed, we were able to get additional resources, and we'll expand it to additional states this year. I will tell you, given the way things are currently going in Congress, we don't know what this will look like next year. If there are significant cuts in budgets, that will be a real challenge for us to sustain some of the growth in this program, which is why it's so important that we are continuing to call out the ways the president's budget is supporting and would continue to grow our efforts to combat and to turn around the unacceptable disparities in this maternal health crisis. And so we look forward to continuing to work with you. We thank you for the work that you are doing every single day. We are only able to continue this work and make the case for these resources, because you are delivering on the ground in community after community. And we know that is life-saving work. And we thank you for all that you do. And with that, I'm going to turn it back to Dr. English.
Thank you, Administrator Johnson. Hi, everybody. I'm Karen Marks. I'm the Director of Strategic Partnerships at the Department of Health and Human Services, focusing on maternal health and public-private partnerships in this space. I want to thank everybody for joining us today, and Administrator Johnson as one of our great leaders and advocates in the doula space. For today's agenda, we actually are not going to do a formal Q&A, but we do want to interact with everybody. I really appreciate everyone introducing themselves in the chat. And as the panelists speak that I'm about to introduce you to, we invite you all to send in your ideas, thoughts, and recommendations to us on how we can better elevate the role of doulas, ensure more individuals are able to access doulas, and better support the doula community. So with that, I want to introduce our esteemed panelists today. Two of them you may have seen recently on 60 Minutes, their national debut. First, we have Latona Giwa, who's a co-founder of Birthmark Doula Collective in New Orleans, Louisiana. She's a birth doula, registered nurse, internationally board-certified lactation consultant, and a birth justice advocate. We also have Chanel Portia Albert with us, who is the founder and chief executive director of Ancient Song Doula Services, a reproductive health organization focused on providing resources and full spectrum doula services to women of color and marginalized communities throughout New York and Northern New Jersey. And to round out the panel, we have another federal representative, Dr. Dora Hughes, who's the Chief Medical Officer at the CMS Innovation Center within CMS. And she leads the center's work on health equity and provides clinical and policy advice to the agency. With that, I'm going to turn it over to Q to moderate the panel.
Thank you, Karen. So I'm going to go right into our questions. We're so excited again about having these esteemed panelists with us. And I want to start with Latona and Chanel. So let's take it from your perspective. What do you, we're going to call it the secret sauce, right? What do you offer that helps to achieve better maternal and infant health outcomes for your clients? Let's start with you, Latona.
Greetings. Good morning, everyone. I also just wanted to say how thrilling it is to see all the doula programs and representatives in the chat. Over the last 12 years since starting Birthmark, it's been so beautiful to see this movement grow, and it truly is a movement for birth justice. So thank you all for being here. So as doulas, we offer high touch care. Right? So in the United States, we spend more than any country in the world on maternal health care, yet have the worst outcomes of any developed nation in the world. So high dollar, high tech care is not solving our problems. Doulas bring high touch care. We build trusting and therapeutic relationships with birthing families in our communities by spending time with them, right? So studies show that doulas spend at least 10 times, and I think it's actually multiple fold of that number of hours with birthing families than the obstetrician or nurse or other healthcare providers can or do. And so we know our clients and they know us. We also are there mitigating the devastating effects of structural racism and provider bias that our clients experience, providing culturally relevant and community-based care. And then we're also helping to mitigate the toxic effects of chronic stress. And we know how stress impacts pregnancy outcomes for our clients. So by providing trauma-informed therapeutic relationships and honoring their experiences and being present with them, we are truly not just saving lives, but helping families thrive.
Thank you for that, Latona. I'm going to turn it over to you, Chanel, to talk about your Ancient Songs role in this as well.
Greetings, everyone. So the chat is on fire, and I do want to acknowledge all of the doulas who are out there and the allies of doulas. I know oftentimes as doulas, we can feel like we are working in silos, and that our work is not necessarily being seen or recognized in the places in which we are. And please know that you are definitely seen, and we appreciate you all. And so Ancient Songs work, is much like Latanya said, we're focused on providing culturally humble care. We're centering the experience of understanding intergenerational and the complex identity that someone is coming with. We are really looking to advance reproductive health policy. And so for our work in particular, on a city, state, and federal level, like we have been on the front lines of really lifting up Medicaid doula reimbursement, hosting national convenings for doulas who are doing the work. Within the state of New Jersey, we have the National Birth Justice Collective, which is really focused on doing a landscape analysis, understanding what does it mean to be in a diverse ecosystem such as New Jersey, which is rural and urban at the same time, and combining the two, and to really lift up birth equity in a meaningful way. And most recently, I had the opportunity to speak and sit with the Vice President, Kamala Harris, around the role of doulas, right? And a lot of that, it was a meaningful opportunity. And one of the poignant things that she said to me that wasn't caught on there was, you doulas are doing so much work. When are you resting? Right. And I was like, wow, that's a really good question. When are we resting? Right. And understanding that we too are parts of our community ecosystems that we're not separate of, and we're experiencing the same things that the people that we're working with are experiencing. And so I think it was a reminder that as we do this work, as we're centering our communities, to remember to center ourselves in the work that we're doing. Because, as Latanya said, this is human touch. It's about human connection. It's about centering someone's humanity. And you can't do that if we can't even see our own, right? And as we become reflections of what we want to see in our communities, it becomes really important for us to be the examples that we want to see, because people are looking to us. People are looking to us for answers, for guidance, for reassurance that as they are navigating these systems of oppression, these institutionalized barriers to care, that we are going to help to guide them through that. And it won't oftentimes be as easy as we may think, but in creating really like intentional relationships, so like the relationships that we have with you all, and centering this conversation, but also with providers, right? I think it's really important that, I see there's a lot of OBs on here, there's researchers, there's nurses, right? And so as we are working as doulas, really connecting with those folks, right? Seeing what the barriers are to them being able to lift up the supports that are necessary within those specific institutions, and finding creative ways and solutions for us to be able to work together.
Wow, thank you both for that. And I love that statement, high touch care, right? And so but at the same time, Chanel, you brought up the importance of self-care. And that's for everyone that's on the front line, that's in the chat. That's part of the panel, that while you're doing this extraordinary work, don't forget about self-care. I want to have one more question before I turn it over to Dr. Hughes. We as an administration value doulas and the role they play, and yet we know that only a very small portion of the population utilizes benefits from them. Is this an education and lack of awareness, availability? Is it a workforce issue, which could be barriers to entry too high and reimbursement too low, or some combination of all of the above? So Latona or Chanel, if you want to tackle that question.
I guess I can go. I think it's a combination of all of the above, right? And so nationally, we're looking at a lot of energy being put into doulas, right? And doula organizations, which is wonderful. in and of itself, but the capacity in terms of workforce development is not necessarily there yet, right? And so when we can look at it from an individual perspective, but also from a community-based organizational perspective. From an individual perspective, the average doula really doesn't have the necessary capacity, the individual doula, excuse me, doesn't have the necessary capacity to reach everyone that they would probably want to, and to be able to serve their community without actually having the necessary resources that are in place to be able to do that. Not only to do it in a way that's safe to the consumer, but also for themselves. We're also looking at reimbursement. And when I say reimbursement, I'm talking about, in particular, Medicaid doula reimbursement. We're looking at it from a perspective that is looking at an individual payer model for work that was seen as ancestral and traditional, right? And so as such, you will find the two parties are butting heads, right? Because you are coming in contact with a framework that's really structured on a different type of policies and procedures, right? Because I don't want to say that there's no policies and procedures in ancestral work, because there is, right? But understanding them is two different things. I will also say that on a community-based organizational level, you have the reimbursement model that, again, so oftentimes it can be too low, but it then also doesn't come to benefits with the organization, right? And so I'm always of the mindset that you should not be operating in a deficit, right? And what can often happen is people don't understand the mechanics of Medicaid, and that Medicaid doesn't pay out claims in an automatic process, right? It's not like, oh, you did this work, you put in your claim, it's going to get processed one time. That's not how it works. It could be 3 to 6 months before that claims get processed. It also, by the time it comes, could be denied or only partially paid. And so if the community-based organization doesn't have some sort of safety net funding, or if we're not looking at administrative costs that can be added into Medicaid doula reserves reimbursement, then we're really not going to see successful models, because eventually people are going to say, we can't do this anymore, right? It is not sustainable. The other issue, I think, is that there is a high turnover of doulas because of the fact that doulas oftentimes have full-time jobs as well, right? And so if you are working with, if you have a full-time job, but this is your passion, you're like, I really want to do this work, I want to be involved in my community, but you can't figure out how to get out of the system of the full-time job, then you find yourself having to eventually, you say, I can't do this anymore, as much as you may want to. And so we need to think and start looking at models that are going to offer sustainability. Like, how about providing funding so that you can hire full-time doulas, right? Full and part-time doulas, offer them a salary, offer them benefits. So then that way they're able to do the work. They can be a greater touch point within their communities, right? And then you can start to, and that's where the workforce development comes in, as opposed to just having these folks just come in and they're just doing this work and it becomes like a one-off. And it's because it also doesn't offer sustainability to the organizations that are providing the work. And then to your last point, just in terms of, I'm looking at the chat at the same time and I'm trying not to, but like folks are like really in it. So we have workforce development. And then when it comes to just the community at large, there are oftentimes some misconceptions about Medicaid, right? And so, folks are like, are you going to be a mandated reporter? What does this mean for me going in, applying for another service? Sometimes it can mean, well, is that for me? So there has to be a lot of education around normalizing the role of the doula. As much as many people know about it due to like social media and Instagram, I think a lot of it is glossed over and it becomes like this commodified entity where people think this is what it looks like. And when you're a community-based doula, it's totally different. Like we're giving away diapers monthly. We're giving away, formula. We're helping with, breast and chest feeding. We're, working with folks who are like on substances and, who are incarcerated and at the very intersections of care. And I don't think that people really feel like, oh, I think it's on one hand, yes, I need this, but how do I get it? And on the other hand, or is this for me? And will this affect something else in my life if I get this? So it's multifaceted.
Thank you so much. No, I think this is a perfect segue to receive comments from Dr. Dora Hughes, who's the Chief Medical Officer at the CMS Innovation Center. And so at this time, I'm going to turn it over to her to talk about what CMS does in the space of improving maternal health outcomes. Dr. Hughes.
Thank you. Thank you so much to you and Karen for inviting me to join this event today. I will also confess, just like Chanel, I am somewhat distracted by the chat and enjoying, thank you for all of you who are sharing your thoughts and as well as your contact information and other insights. At CMS, I just want to take a step back. At CMS, equity is the foundation of all that we're doing. We want to ensure that our programs are operating to reduce the health inequities that all of us know underlie our entire healthcare system, is especially lifted up by the COVID pandemic. We are working hard to break down barriers to care, to lift up underserved communities. And that's part of the reason why we released about a year ago our comprehensive health equity framework. It has a number of different pillars within the framework that focus on integrated, action-oriented approach to advance health equity among members of our communities who have been historically underserved or disadvantaged, and for the providers, plans, and other organizations serving such communities. Overall, we're looking across all of our policies agency-wide at CMS, ranging from, as we've touched on here and in the chat, approval of Medicaid demonstrations to the measures that we're using to evaluate quality, all of that through a health equity lens. But our administrator is not secret that for all of our health equity work, one of her absolute top priorities is maternal health. As she believes, and she says very frequently, the health of our nation begins with the health of our mothers and children. And we are all aware that we are facing a worsening maternal health crisis, even though 2 out of 3 pregnancy-related deaths are preventable in this country. We talked about the administration itself has made preventing maternal mortality and morbidity, and especially addressing the inequities in maternal health, a whole of government priority. And I'm so proud that CMS is very much doing its part. About a year ago, we released our maternity action plan, which is designed to support the Biden-Harris plan, focusing on improving health outcomes and reducing inequities for people during pregnancy, childbirth, and the postpartum period through a holistic and coordinated approach across the agency. Just to share a few examples across our plan, which focuses on 5 areas. First, we are working to expand coverage and access to comprehensive healthcare through all of our programs and to help ensure continuity of coverage before, during, and after pregnancy. That's why I'm glad to report we're very excited that as of today, 33 states and DC have taken up the option to provide 12 months of continuous postpartum coverage through Medicaid when families absolutely need it most. We're also expanding our data collection efforts, building a better understanding of the key drivers of health to identify disparities in care outcomes. We're improving the quality of care by working directly with health systems to increase the uptake of evidence-based interventions to improve the care that people receive. As part of this work, many of you may be aware we developed and have rolled out the Birthing-Friendly Hospital Designation Initiative. This designation will appear as a special icon on our CMS Care Compare website that we're awarding to hospitals that have demonstrated commitment to maternity care quality. We're excited that more than 150 million people covering who are members of health plans that have agreed to partner with us on this Birthing Friendly Hospital Designation Initiative will be touched through this important step. And a 4th area, this is also mentioned when we think about structural racism and the divide, we are working doubly hard to build bridges between the care, the health care that we support and the social supports through our federal, state, and local partners that we think are so critical to providing whole person care to both our pregnant and postpartum enrollees. And then finally, we are laser focused on improving access to a diverse maternity care workforce, including doulas, I love that the vice president asked you when you were resting at CMS. She has been emphasizing we need to keep working hard to make sure that we are working with our state and sister agencies to expand the doula workforce. We have heard, and I'm certainly taking more notes today, about the issues relating to coverage and reimbursement for doula services. This is an issue I can promise you that we are exploring earnestly at CMS to think about how we can assist. But all of this is just the beginning, steps to build on. Our work is not easy, but we again are committed to partnering with all of you and the range of organizations and stakeholders to help ensure that all mothers get the care that they need to improve health outcomes and to reduce inequities. When it comes to our maternal health crisis, our administrator, Chiquita Brooks-LaSure, she often states very firmly, enough is enough. And at CMS that we must continue to use every available opportunity to advance and enhance maternal health. So thank you so much again for inviting me to join the panel, and I'm looking forward to the rest of the conversation.
Thank you, Dr. Hughes, and thank you for all the work that CMS is doing in the maternal health space. And I'm gonna do a follow-up question with Latona. We heard from Chanel on some of the challenges that we were encountering. So what, as the federal government, can we do to uplift you all and address these challenges?
Yeah, absolutely. Thank you for that question, because this truly is a national issue. And for those of us working in the Deep South, where it is extremely dangerous to be a pregnant person at this time, as well as to miscarry or have pregnancy complications, we especially need the support on a national level. So national policy that, as Chanel spoke, supports just reimbursement and sustainable pay equity for birth workers, including doulas, but also lactation consultants and other perinatal community health workers, is absolutely essential. Most doulas in this country are independent contractors, which means that we don't have benefits. And I think it is, or many of us do not have benefits. And I think it is a great irony that birth doulas, who are giving so much to support pregnant people to have the best possible outcomes, often don't have access to things like paid parental leave or health insurance. And so or access to mental health care, right? And so we, who are absorbing all of this secondary trauma, supporting our clients in institutions that are not designed for our best outcomes, are then also likely to suffer poor perinatal outcomes ourselves, because the system is not designed to support us. And I'm a huge advocate of cooperative businesses and for birth doulas being able to form cooperative businesses so that we can be owners of our own labor and create policies that support us, allow us to rest, allow us to have benefits, allow us to determine the policies and protocols that we know work based on these ancestral traditions. And so federal policies that support the formation of cooperative businesses, women-owned businesses, I think are actually really essential to this movement. In addition, we have to look at hospital policies and federal directives that encourage hospitals to actually support and include doulas in the collaborative perinatal teams. Again, I'm in the Deep South, and there are still many providers and hospitals that do not want doulas in the birth room, despite our hugely well demonstrated impact, right? And COVID showed us this. The first people kicked out of the birth room were doulas, right? Even though we're an essential part of this team, and that should not be happening. So we need to treat doulas like interpreters, like lab techs, like anybody else. And we need to be welcomed into that space. And then, I think that also, as y'all have spoke to, expanding Medicaid through the first year postpartum and beyond is essential so that families can access our care and we can access health insurance.
Thank you so much. And do know this call is to celebrate you, and we want to hear from you of what we can do as a federal government to improve maternal health outcomes through your work. And so thank you for being a part of this conversation. And we do want to hear more about the strategies with that you implement. So we may tackle that a little bit later in the call if we have time. But I just want to thank the panel that's on right now. Thank you for your time. Thank you, Dr. Hughes. I know your schedule is quite hectic. And so at this time, we're going to shift to hear comments from our Commissioner, Patrice Kunish. Thank you again, panelists. So I'd like to welcome Administration for Native Americans Commissioner Patrice Kunish. She is the Standing Rock Lakota descent and is committed to doing her utmost to help American Indian, Alaska Native, and Native Hawaiian and Pacific Islander communities. She has broad experience serving Indian country, and we're happy to have her share with us today. Commissioner?
Mpe tuwaste mitakuapi, shante washtea te mahebo. And what I shared with you is a greeting in Lakota, which is good day, my relatives. And I'm really feeling very much related to all of you on this really important special topic about maternal care, maternal health, and what it takes to support our mothers and children at that very precious moment. I also said, come together with a good heart. And that's really a beautiful way to understand how we organize ourselves and how we meet each other with good intentions around today, the topic of doulas. And what I should share is that I've never known a doula, but I've had two midwives in my life that have made my experience so much more rich and rewarding and personal and humane. I was a young mother on public health and did not receive the best care or attention except for a wonderful midwife who helped and attended me in my time of real need. What I'd like to share with you today is just a few thoughts around the disparities, but the resilience of American Indians, Alaska Native people, and the larger population of Indigenous people that we at ANA serve. We're a very small agency in the Administration for Children and Families, but through our work, mainly through grants, we are supporting at some of the most basic levels the care, the well-being of mothers and children. And some of our work really does touch upon the underlying conditions, the root causes of why we're seeing such disparities in our maternal care. So let me just share with you a few backgrounds. We've heard about the danger of giving birth in the Deep South, and we find that to be the case in many of our Native communities as well, unfortunately. And while I'd like to say that deaths related to pregnancy are rare and complications also are rare and probably preventable, we still lose too many Indigenous women, mothers each year from complications relating to pregnancy. And that means prenatal care, during the childbirth experience, and postnatal. Alarmingly, American Indian, Alaska Native women are 2 times more likely to die of pregnancy-related causes than white women. And this is just so totally unacceptable that to be a Native woman is a cause for pain, for danger, for utmost risk. And we experience these disparities in so many ways. We have a lot of historical trauma that we're carrying with us from generation to generation. We've had a cultural erasure that contribute to health inequities along the way. And I think there's a direct connection that due to our ongoing and the inherited trauma that we have, that American Indian and Alaska Native Indigenous people are really more likely to suffer underlying chronic health conditions and as we've heard earlier, experience sexual or interpersonal violence at such extreme rates that it's devastating. So despite these challenges, I want to say that we are resilient, we are strong, and we continue to thrive. And I think there's a very important place for doulas to be recognized in a very traditional way in our Native communities, in our Indigenous traditions. Many of our Indigenous people and communities really do draw on the strength of our culture and traditions. And women, sisters, aunties, grandmothers, cousins, all supported the woman throughout her pregnancy, through childbirth, and afterwards. And we've come far, far away from many of those traditions, mainly because we have a very complicated healthcare system, or if we don't have access to healthcare, it's also become a real challenge to understand that health condition and those health disparities. But I do believe we have resilience, and that resilience is built through our culture, our traditions, and these, as I say, the kinship care that I described, are really are building on spirituality, our shared values, I think a really strong sense of identity. And collectively, these are protective factors. So I do think of a doula in a very traditional way of being that person in our community who helped and supported the women in their maternity mode, but also supporting that rich child care right after childbirth. So we are very much in support of promoting, supporting health and well-being of our Indigenous people. And I think we can really wrap our arms around employing Indigenous social determinants of health, culture, traditions, ceremony, and spirituality to really enrich the experience of Native women and give them more successful outcomes. So thank you very much for letting me participate in this discussion.
And thank you, Commissioner. And do know that we do have American Indian Alaska Native organizations represented on the chat. I've been seeing some of the responses in the chat. So this is great. And thank you for sharing. And yes, we're all in this together. And so at this time, I'm going to turn it over to Gail Golden, and she is the Deputy Director for the Women's Bureau, Department of Labor. Gail?
Thank you so much. This has been such an interesting and informative conversation, and that chat is so interesting to hear from all of you. So I'm really honored to be able to join all of you today. I'm also, my colleague Mathilde Roux from the Women's Bureau is also on today, and she has been helping me do a lot of work with doulas in the past few months. So I wanted to acknowledge her work here today. For those of you who are unfamiliar with the Women's Bureau, we're about to turn 103 years old. We are the only federal agency mandated by Congress to stay laser focused on the needs of working women. So it's delightful to join in the celebration of doulas. I thank our friends at HHS for inviting us to attend. And I think, you know, we really heard it today about the workforce part of doulas as well. And that's where we at the U.S. Department of Labor come in. So at the Women's Bureau, we have been talking with doulas about how to create a more diverse doula workforce, what would increase your own job quality to make sure that these are high quality jobs. And that includes what would it mean to have doula care covered by health insurance. So in February, Women's Bureau held 2 listening sessions, one in Birmingham, Alabama, and one in Providence, Rhode Island. And we picked these 2 places for a couple of reasons. While Alabama does not currently have insurance reimbursement for doula services, the city of Birmingham has launched a pilot program to support doulas. And we picked Rhode Island because as of February, it was the only state in the US that reimburses doula care in both public and private health insurance. So what we heard during those learning sessions is very much what we heard and are hearing in this chat today. Here's some of what came up. Doula work is intense and personal, and some describe it even as a calling. And we heard from doulas who missed their own family celebrations and birthdays because they were providing care to a birthing parent and their family. And we heard so much about how this career is both rewarding and traumatizing, and sometimes at the very same time. And what we heard many ways in which we as the federal government and others can support the doula workforce, diversify it, and make sure that you are finding a path forward as we include more people in the doula workforce. So there's so much more in that report. We are going to be releasing it next week on May 16th. It will be available on the Women's Bureau website. And on that day, we are also having a webinar specifically for doulas and midwives that explains the rights pregnant and nursing workers have in the workplace. That is co-hosted by the Women's Bureau, the Wage and Hour Division at the U.S. Department of Labor, and the EEOC. So we invite you to participate in the webinar. It's also going to be available afterwards on the website, but if you'd like to watch it live, and you can certainly pop in your questions into that chat as well. So we'll be talking a lot about what rights you have as both as doulas and for the clients that you serve. So on the behalf of the Women's Bureau, I just want to again take this moment to celebrate all of you, your hard work, your dedication to your clients, and thank you for all of your efforts.
Thank you, Gail. I am dropping in the chat, so going to be at the top right now, the information on the webinar, as well as if you want to learn more about other topics that impact working women, you can check out the Women's Bureau website. So that is now in your chat. Again, as to Karen's point, please provide your recommendations, your ideas, etc. Just drop it in the chat and we'll make sure we'll respond accordingly. And in these last 3 minutes, I do want to ask the two doulas that are on the line, I want you to have the final say here before we close out. This question. So it is our joint goal that we want all people giving birth to be heard, listened to, and supported. So what does a respectful, holistic model of care look like from your perspective? And how do we get from where we are today to there? So Chanel, you want to start out with that answer, and then we can close it out with Latona, and then Karen will give us final remarks.
So I want to say that it is person-centered. It is non-transactional. But I also want to lift up the fact that all of the placement can't be placed on the doula as well as the patient or consumer, right? I like to also call folks consumers because I think we have to think about the fact that Medicaid and the ways in which we navigate within health systems is based on a business model and not on necessarily care models that are driven to uplift folks always. And so I think it is an approach that needs to be taken from the perspective of also engaging providers. So again, OBs, nurses, midwives, anyone who is a social workers, anyone who is a touch point for someone who is pregnant, fathers, right? Partners needs to be engaged in really meaningful ways so that all of the placement on one, centering oneself when they're pregnant, also thinking about now I have to advocate for myself while I am pregnant. Now I have to think about getting a doula while I am pregnant. Now the doula is just trying to provide doula services, but it's not able to do that because a lot of our work is thereby shifted towards providing advocacy as opposed to direct human-centered care, right? And so it pulls away from that. And so I think that as we are doing our work, we really have to look at how maternal health institutions are really centering the conversation around creating environments that are conducive, not just for birthing people, but for the folks who are working within them so that they can provide adequate services to the folks who are coming within their institutions. We need to have more universal policies around maternity care that really centers frameworks of understanding evidence. And when I say evidence, I don't mean evidence that is based on just numbers, but also the lived experiences of individuals. And so really looking at the culture of data and how that culture of data is really informing how we are looking at models of care. And I will leave by also saying that we need to really look at implementation and accountability. And I can't stress that enough, because there are a lot of great initiatives, there are a lot of great efforts to really center the elimination of Black maternal mortality rates. But if we're not looking at how legislative bills are being addressed and how accountability measures are being lifted up within those communities, then it ends up falling short. And so it's not just one answer. I know I was supposed to just give one answer, but it's not just one. It has to be something where we're engaging the patient consumer, we're engaging the doula, we're engaging the IBCLC, the lactation counselor, the childbirth educator, the nurse, again, the OB, really educating. And so like, what does it really mean to have collaborative care frameworks? And what does it mean to work from a culturally humble perspective where we're learning from each other and we're not providing reactionary care? Because what I noticed is that a lot of the care models are also focused on reaction as opposed to us being responsive to community needs, right? When we're more responsive to those ecosystems, then it becomes easier, I think, for us to provide individualized care as opposed to this one size fits all for everyone.
Oh, this is great. Latona, just so you know, this conversation is now encouraging people in the chat to become a doula. So this is amazing. And that's why we celebrate you, because we do need to expand the doula workforce. So Latona, please.
Yeah, I love that. I think the chat is the best part of this call. And thank you, Chanel. I always, every year or two when we get to be on a call together, I always learn so much. So thank you so much for being a champion of this work. So just adding to that, even though Chanel pretty much covered it, but I just want to emphasize that reproductive justice is our roadmap. Right. And so when we look at our entire perinatal healthcare system, we need to ask at every level, for every type of provider, for every patient family interaction, is this serving to give people their human right to have children, not have children, and parent and raise their families with safety, dignity, and respect to thrive? Right. And if in any way it is not accomplishing that, we need to address that. Right. So reproductive justice is our roadmap, and we should be adopting that philosophy as our standard of care across the board. And within that, we need our providers, our care team, our doulas, everyone who is championing this philosophy to also be diversified and representative of the communities they are serving, because it's not enough to do bias training. It's not enough to read the evidence. We have so many studies that show being cared for by someone who comes from your community makes the difference, right? Your healthcare outcomes will improve just if you're a Black person, just by having a Black person in the room. And we have a crisis of representation and diversity in medical schools, among physicians, among midwives, and among all levels of healthcare providers in this country that needs to be addressed. I'm so happy to see in the chat that we have doulas and representatives from so many communities. We have queer folks, gender folks serving genderqueer and transgender people. We have Native groups, we have immigrant groups, and we just need to expand that because people need to be represented, seen, and listened to in their care.
Thank you so much.
I just want to add to that. I just want to add too, it's also not just about having someone that looks like you, but also having someone who understands the pathways to reproductive health and what reproductive justice means, right? Because, I train medical residents and others, and a lot of their frameworks are not based on frameworks that are really centering community care models of care. And so as we look to Black, Indigenous, people of color, and to our LGBTQ partners in this work, we also want to make sure that they too are educated in the frameworks that LaTanya was bringing up, which is reproductive justice and birth justice, to really push forth in birth equity. And that means that it's ongoing. As you said, it's not a one and done, like I did this and now I'm good. It means that you are consistently, again, learning from and learning with each other. And we can only do that when we really take a moment to humble ourselves within the space and to really listen and to hear how things are changing within our respective communities and ecosystems.
Wow, thank you both. Thank you so much for sharing. You just really described the village, right? They say it takes a village to raise a child, but it takes a village to improve maternal health outcomes in our nation. And we at the federal level are committed to continue working in this space until the U.S. becomes one of the safest places for women to give birth. To that end, I'm going to turn it over to my colleague, Karen Marks, for final remarks.
Thank you. And I really can't top the conversation that we just had. But I do want to thank everyone, Reverend Q English as my co-moderator, our doula representatives as panelists, our federal representatives, and most importantly, those of you all who joined the call.
Yes.
I think during the last hour, we celebrated, we learned, and clearly the most valuable component of this webinar was the chat and the connections that were made. It was really uplifting and heartening to see that. It's clear that this community is an enriching, beautiful, and positive one. And we look forward to continuing to uplift your all's work on the federal side and celebrating the truly life-saving work that you do. On a logistics note, we will share the resources that were mentioned, the link to the webinar after the event. You'll see an email from us. And with that, right at the top of the hour, I'm going to close it out. And thank you all for joining us today. I think this hopefully set the positive tone for everybody's rest of day. Thank you, everyone, and have a great day.
Thank you.